Peter Block in Orlando at the AHA annual meeting for On the Scene, and with me is Karen Alexander from Duke, a neighbor of mine since I'm at Emory, but a good friend. So we've heard about the RIVER-PCI trial before, Karen, at TCT. It was presented. At that time, it was ischemia-driven revascularization. So you looked at these same data again. Tell me what you looked at in RIVER-PCI that may be different.
We actually reported here on the patient-reported angina and quality of life outcomes that we collected in the same population, because ranolazine is a drug effective on angina, at baseline 1 month, 6 months, and 12 months. And similarly to the overall results, we did not find an effect of the addition of ranolazine in addition to standard therapy on angina over time.
Well, now, wait a minute, Karen. This is silly because we know ranolazine works in the clinic. I give it to my patients. You probably give it to yours.
Absolutely.
So what's going on here? How do you interpret this?
Well, it's important to know that the vast majority of patients in both treatment arms were angina-free or had monthly angina at 1 month. So basically, the qualifying PCI itself, despite a history of prior angina, made most patients angina-free. So there was very little angina left.
So you're left with two populations of patients that had very rare angina, and showing a difference in those two small populations would have been very difficult.
Exactly. We did look at those who had more angina at baseline and did find a significant benefit in that pre-specified subgroup, as well as in the pre-specified subgroup with diabetes. But overall, there was no difference.
Okay. So let me think now as an interventional cardiologist / physician here. Ranolazine isn't going to be thrown out, number one, because it still is useful in patients with angina. But what I also take away from what you're telling me is that PCI seems to work. Is that fair?
Yes, I think it's really important that to assess angina over time is what I would say. These are patient-reported outcomes, and it's really important, particularly if you're trying to intervene on angina, that you assess it at intervals. And most patients did do very well after PCI.
So PCI works. That's the good news.
Yeah.
Ranolazine certainly works. We know that from the clinic, but when you do a really good PCI, it's really hard to differentiate whether ranolazine makes any difference going forward. Fair enough?
Fair enough. Yep.
Thank you, Karen.